I'm Lauren Gardner. I'm an FDA reporter with Politico, and I have with me Dr. Robert Redfield, former CDC director. He's joining us virtually. Hi, Dr. Redfield.
Hey, Lauren. Thanks for having me.
Yeah, thanks for joining us. All right, well, let's just get right into it. In the past few days, we've seen mass firings across federal agencies, including several health agencies and the CDC, NIH, FDA. I want to ask you specifically, for people working in the public health space and from your perch as a former director of the CDC, what do you fear or anticipate the impact of these terminations are going to be on the nation's public health?
Well, I think we have to look at this moment in time. It's really a potentially transformative but a disruptive time where a lot of these agencies are going to be asked to resize themselves and relook at their priorities and to see if they're meeting those priority goals. I think what's most striking to me personally, as someone that's been in medicine more than 45 years, is despite everything we've done in the system of health that we've really developed a disease system. We really haven't developed a health system. We haven't put a priority on health. I always remind people it's the National Institutes of Health, it's not the National Institutes of Basic Science. And so I think this is an opportunity to look at what those priorities are. The fact that 77% of young people graduating from high school can't pass a military entrance physical exam, that's very disturbing. The fact is, we have a chronic disease epidemic in America that's substantial. So I think part of this is looking at these agencies and trying to resize them for priorities. I don't know what the ultimate consequences are going to be, whether it's going to be good or not good. I do think, though, that we could all strive to focus on this time to transform our health systems and our health agencies so that they're focused on health. They're not focused on what I say is that we build a disease system. We need to build a health system. And whether that's the research that NIH does in chronic disease to look at solutions, whether that's an agency that I ran, CDC, which I have enormous respect for, but I will say that that agency has sort of moved away from its primary mission of what I call a public health response agency. It's actually become culturally very much like an academic institution. It needs to grab hold of its needs to be a public health response agency and really build that. And a public health information agency and an agency that helps the public understand the critical aspects of their own interactions for public health. So I'm not willing to judge it at this point, whether it's ultimately going to be a negative or positive thing. I have a lot of confidence in the men and women that are in these agencies, at the FDA, for example, where you work, NIH and CDC. These are either rock solid people committed to the health of America. I do think they may benefit if we have political leadership to refocus our nation's effort towards that goal of health, as opposed to kind of status quo. And let's see. I mean, we have obesity rates in America that are over 50%. When I was CDC director, one of the things many people didn't understand, we had one of the most successful vaccine development programs in the history of the world with Operation Warp Speed. And yet we still lost almost 1.2 million people in the first couple of years. How do we do that? How did that happen? Countries like Taiwan lost around 5,000. And the reason we lost so many people, as I tried to explain, is that basically we're not a healthy nation. That COVID really took out those of us that had chronic diseases, diabetes, hypertension in particular. And so we need to try to get on a path to make America healthy again. And central to that is to get the full engagement of our key public health agencies, which I would argue are NIH, FDA, CDC, CMS, and really look to see how are we operationalizing these agencies optimally for the long-term benefit of health of American citizens.
On CDC specifically, how would you suggest the agency reprioritize and refocus, like you said, to focus more on public health response as opposed to academic concerns? And if you could be more specific about what you mean by that.
Yeah, I'll give an example. When I was CDC director, one of the first briefings I asked I think it was in the first week of April of 2018, largely was a briefing on opioid-related deaths. We had an estimate of 80,000 deaths of young people that year. It was personal to me because I almost lost one of my 6 children from contaminated cocaine with fentanyl and almost lost his life. I saw drug use disorder up close and personal. I thought I understood it as an infectious disease doctor, as a doctor that practiced AIDS in Baltimore for more than 20 years, but I can tell you I had no concept of the impact of drug use disorder until it entered my own family. Obviously, it was important to the president. He actually provided substantial resources to revamp our programs towards drug use disorder. And when I had that briefing, and it was an excellent briefing, again, these are top quality men and women that work at CDC, no question about that. And I asked at the end of that briefing what the data was through. And the gentleman told me it was through March 2015. And I said, but it's April 2018. And he said, you know, Director, you don't understand the complexity that we have in getting data from the states, getting reported from the states, getting the data curated. And I said, no, when I came to CDC, I was excited because I thought I had an opportunity to work with the greatest public health agency in the world to impact the human condition. And you're telling me what I really came down here to be a medical historian. In other words, we don't have real-time data systems. And you can't have a public health response agency if you don't have real-time data systems. I was able to get Congress to put in a bill to do modernization of our public health data systems, and they did. In the first year, we got $350 million to begin to revamp the public health data system, not just for CDC, but for the whole country. I mean, we had our first measles outbreak. I had public health officers sending CDC information by fax machine. That's how out of date some of this stuff is. And the fact is, $350 million for the whole nation to have a public health data system was off. I had estimated it was going to cost about maybe $25 billion over 5 years to redo our data system. So we haven't put the energy into building the system to really be able to respond. We saw it again when monkeypox came in. CDC is a great organization, but what they ended up doing is kind of historically following monkeypox as opposed to going in there very aggressive strategically to try to block the introduction of monkeypox into our gay population in America. I think CDC has the potential to do that, but even I can give you one other example. When I was asked about promoting people at CDC, and I looked at what they had accomplished, if I had looked at, you know, did they go to work on the Ebola outbreak in Africa, or what had they done to the opioid epidemic outbreak in West Virginia, that wasn't a criteria. What the criteria was I was asked to use was how many papers they published. I don't think that's the answer for how we promote public health response agents in our country. So I do think the agency needs a lot of refocus towards public health response. And I think they'll get it. I know my pastor, the director after me, began to try to do that, and I know Mandy's after that is trying to do that. And I think, you know, those are the kind of things we should take advantage of during this disruption, that we actually make sure the agency moves towards its mission, which is to be a public health response agency.
But do you think the agency can do that kind of work amidst such disruption, especially if you're seeing large chunks of the agency be terminated?
Well, I think you have to look to see how it's reprioritized, the personnel. I mean, I had a lot of personnel, obviously at CDC when I was there. I think if you, maybe 14,000, if you added all the contractors, it may have been close to even 20,000. I know if I had gotten the second term, I had wanted to take CDC, which had, you know, maybe 10,000 people in Atlanta, And I wanted to see them be more dispersed in the 50 states across the United States so they could help the local public health agencies be more effective in their public health response. I didn't think the answer was 10,000 people in Atlanta. So I do think there's opportunities. I don't think this nation's going to compromise at the end of the day the important mission that CDC has. And again, depending on the leadership that actually eventually gets into CDC, I think particularly as we're all looking today about concerns which I have, the COVID pandemic was a real challenge. There's no question about that. But to me, it was a minor epidemic compared to the epidemic that's coming, which is the bird flu pandemic. So this is not a time to cut our ability to have a rapid public health response agency. So I know I will continue to argue for that and look to see that in these decisions, these personnel decisions that are made, that they haven't compromised that mission. I'm not ready to prejudge it and say, okay, yes, it's going to be problematic. But I do think we have to look vigilantly to make sure these agencies can meet their mission.
We're going to come back to bird flu, but first I wanted to circle back to leadership at HHS. You've been very supportive of now Secretary Robert F. Kennedy Jr. Tell us more about why you think he is going to be a successful HHS secretary and what that looks like to you.
Yeah, I do believe, and a lot of people are surprised, because I'm one of the strongest advocates for vaccine in our nation. I think vaccines are the most important, I say, gift from science to modern medicine. And when I was CDC director, one of the things I worked hard on was vaccine hesitancy. I was very upset that less than 50% of the American public took the flu vaccine. I was very upset of the over 350 children that died of flu my year, more than any other year in the history of our country. The one thing they had in common, their parents chose not to vaccinate against flu. You saw this year we've already lost over 65 kids. What they have in common is their parents didn't vaccinate flu. I wanted to change that scenario from vaccine hesitancy to vaccinate with confidence. And I still feel strongly about that. So some people are surprised that I embrace Kennedy. I will say that Robert Kennedy is not anti-vaccine. All right, what Robert Kennedy is for transparency about vaccines, honesty about vaccines. Let's look together at the data that we have about vaccine safety. Let's just not brush it aside and say, oh, well, these vaccines are safe because we've used them forever. No, let's look at the data and make sure that the American public understands the safety and the benefit. I have no doubt that Kennedy will not take away any of our vaccines. He's going to support our vaccines. Now, has he been surrounded by some people that are aggressively anti-vaccine? Yeah, there's some people around him that are aggressively anti-vaccine. But he's also now surrounded by somebody that's probably the biggest advocate of vaccines in the country, and that's me. And I will continue to promote that. One of the reasons I support Kennedy is he really sees and really communicates what should have been seen and communicated a long time ago. And that is that our nation in the last 30 years has gone from a healthy nation to a sick nation. When his uncle was president, we had obesity rates less than 3%. Today we have obesity rates close to 50%. Today we have adolescents, obesity rates over 20%. When we had chronic disease rates in the 60s, it was less than 5%. Today, now they're over 50%. We've become a very sick nation. That's the reason when I was CDC director, we lost 1.2 million Americans died of COVID, even though other countries like Taiwan, lost less than 5 to 10,000 people. It's because we were an unhealthy nation, and the COVID virus, unfortunately, knows how to exploit underlying diseases like diabetes and hypertension and lead to increased mortality. I think Kennedy's passionate about making America healthy again, and I think he has a plan that's going to see him good results. I mean, the initial one is obviously looking at what we eat. There's no doubt, and there's good science to support this, that highly processed foods are associated with weight gain. You can have the exact same diet, exact same exercise in a metabolic unit, and one you basically have highly processed food, and the other one you have the food, but it's not highly processed. The highly processed group gains weight. So clearly going after highly processed food could be a way to reduce our obesity epidemic. And then you can add in the other concerns about additives, dyes that are outlawed in many other countries, and whether they're contributing to the epidemic that we have of attention deficit disorder or other mental illnesses that we have. Who knows what's driving the increase in young people that get cancer now? So I think approaching our dietary approach and trying to educate the American people, not mandating, but educating the American people, because I don't think a lot of people really know what healthy food is. And so I think Kennedy's going to accomplish that. The other thing that's very important to me personally, and where I've drawn a really close fondness of Kennedy and his energy and his honesty, is, you know, he doesn't hide from the fact that he was a heroin addict. He understands addiction. And I will tell you that drug use disorder is a major problem in our nation that is not being effectively addressed. And I do think Kennedy will lay out some approaches towards drug use disorder that will be much more highly effective than our current approach to drug use disorder. And then we can go into the chronic disease in general with diabetes, hypertension, et cetera, where I think he'll start focusing heavily on our medical system to build a health system around managing chronic disease more effectively and actually preventing chronic disease than the current system that we have right now that is just sporadic acute care medicine.
Let's get back to vaccines for a couple minutes. I want to drill down on this point. I mean, setting aside whether he's pro-vaccine, anti-vaccine, you know, setting aside that dichotomy, he's raised questions about the status of safety data for vaccines and suggested that there isn't enough out there. Now, there are certainly vaccine safety scientists who think the science could be more robust and would like to see more funding to, you know, dig into why adverse events happen in certain people as opposed to not happening in others, but they don't purport to say that there is no safety data on vaccines. So how do you square those statements with your view that vaccines are one of the greatest public health interventions created?
Yeah, Lauren, I think you said it correctly. Kennedy didn't say there's no data. He's argued that in some of the vaccines, he believes there's inadequate data. My point is we can just put it out in the open and let's have an honest debate about the data that we do have. And for example, if the FDA really does believe the data is robust and adequate for all age groups, let's have it defined. But if we do identify that there's maybe some holes in the safety data, then as you said, you can decide whether we need additional safety data or whether we should set up some post-marketing studies to build on that database, because it is very important at the end of the day that we build, as I did at CDC director, that we build the American public's confidence in vaccination. And one of the ways to do that is to let them see the information, let them see the safety in an honest, unfiltered way. Let them see the efficacy in an unfiltered way. I mean, there are some, you could look.
What is that way, though? That's what I'm curious about, because it's not like this data is private.
I think you could have a review. The FDA could have a review, or FDA, CDC could have a review. For example, if you look at, you saw Cassidy argue this in the hearing, where he was arguing that, and Kennedy was arguing against it, when he was arguing that 1-month-olds should be vaccinated against hepatitis B in the United States. Well, I will tell you, I'm an infectious disease expert and did a lot of work early on in the hepatitis B vaccine. The risk for hepatitis B in our nation largely is as they go into adolescence. It's sexual and it's and drug use disorder. It is true that if your mother happens to be hepatitis B chronic carrier, which is a very low percentage, probably less than 0.5% of Americans, then you would benefit from a vaccine at the age of 1 month of age. But the truth is, for the entire American public, it's probably there's probably not a lot of strong efficacy data that vaccine should come into people at 1 month. Maybe that vaccine should be used at age 10, similar to the human papillomavirus vaccine. So then you say, okay, what data do we have on using the hepatitis B vaccine in a 1-month-old from a safety profile? And I think if you go pull that data, you're going to find it's less than 500 kids and they've been followed for less than 6 months. Now you can decide, is that adequate or not adequate? We can argue about it. But I just think that's what the argument is. Let's be transparent about it. Let's just not classify somebody. And I won't say Kennedy's pro-vaccine. I won't say he's anti-vaccine. I think he's fairly neutral. He sees these as important medical interventions, but let's see where they fall out when we look at the data. It's unfortunate, obviously, that Wakefield had fraudulent research in England that put concerns about MMR and autism, which have been totally, rejected. I think one of the things Kennedy will do is he'll task NIH to do a major scientific investigation. I've suggested that he get a couple $1 billion into Jay Bhattacharya at NIH to have scientists that have hypotheses on the cause of autism and develop research programs so that we can look at and find the root causes of autism, whatever they are. Because clearly something's happened in our country for us to go up to less than 1 in 40 people now have autism. So these things I think are more effective than arguing, people's, comments in the past. I mean, Kennedy, took Wakefield's research as being legitimate. Unfortunately, it turned out to be illegitimate. And obviously he's dismissed that since. So I think part of it is just open. The FDA clearly could just show us the data. I mean, look at the current COVID vaccines, all right? And I was part of developing them in Operation Warp Speed. Have we seen an open, transparent review by the FDA of what we know about the safety of the mRNA vaccines? Have we seen that yet? Well, we should see it. I mean, I'm in clinical practice 2.5 days a week right now, largely doing COVID and long COVID, and I have a number of patients that have very serious long-term consequences from the mRNA vaccines. Let's get that systematically reviewed by the experts, which clearly they have. FDA has some of the best experts in the world, and let's just lay it out there. Let's not hold it back until 2026 and say, okay, we're going to wait until 2026 to share what we know about the safety. So I just think you're going to see greater transparency, which I will argue in the long run is going to do more to increase the American public's embracement of vaccine with confidence, which is what I want. I want the American public to vaccinate with confidence. Nothing saddens me more than as a scientist and a clinician that spent my whole life in vaccine development is to see vaccines developed and have individual people decide to leave them on the shelf.
We're running low on time. I want to really quickly ask you, but kind of in the same vein, you mentioned bird flu and being very concerned about that. Can you briefly just touch on what you're chiefly concerned about here? And then against this backdrop of increasing vaccine hesitancy in the United States, if we did get to a point where the government decided we should develop and deploy bird flu vaccines to the general public, do you think there's an audience out there that'll even entertain going to go get them?
Lori, you mentioned first, it's really important, and it's really an important thing for us to all work together to do. There's no doubt that the public has lost confidence in our public health agencies, and it has to be restored. And it takes a long time to build confidence. It takes a short time to lose it, and we've got to rebuild it. I will argue that when you look at flu, vaccines are not really the approach that is going to get us over the goal line. The real goal line is antiviral drug development. I was part of Warp Speed. We had the most successful vaccine program for COVID, and probably in the history of the world, and yet still 1.2 million Americans died despite that, because the vaccine really didn't prevent infection, and it's not durable. And many flu vaccines at best are 50% efficacious, and not unusual for them to only be 25% efficacy. So I will argue, as we get into the bird flu, relying on vaccines is not insightful. What we need to rely on is antiviral drug development. that we have the medicines that can actually treat us effectively, people who get bird flu. Now, why am I worried about bird flu? And when I was CDC director, I worried about bird flu. When I was praying about whether I would, my wife and I, whether I would accept the administration's decision to leave my job and go to Atlanta, at the time, I had 11 grandchildren, now I have 14. I basically had a premonition that we were going to have a major respiratory pandemic. And I figured as a virologist, infectious disease, vaccine kind of guy, antiviral drug development guy, I would be ideal to go to Atlanta, and I chose to do it. And lo and behold, we had the pandemic. Now, I will tell you that COVID was a minor pandemic. People say it's the biggest pandemic we had in 100 years. It's a minor pandemic. It had probably less than 0.5% mortality, and then only in certain patient populations, those over 60, over 65.
Quickly, 30 seconds. Why should we be worried about bird flu?
Bird flu is going to be a major pandemic. If the cases to date in humans have about 50% mortality. If you look at bird flu right now, it's in over 150 million of our chickens and birds. We now know it's in 48 different mammal species. It's now gotten into humans. It's starting to change in humans. Once it learns how to go human to human, we will have a catastrophic pandemic.
All right, Dr. Redfield, thank you so much for your time. That's all the time we have today. Appreciate you calling in.
Thanks, Lori.